Hello everyone and welcome back to this week's episode of Fresh Future Friday. If you're new here, my name is Tamazha. I am the store manager for Fresh Future Farm in North Charleston, South Carolina. If you're not new here, welcome back. Y'all already know I have my notes ready, so let's go ahead and get into today's discussion, which will be half about coronavirus. I didn't want to spend my whole time today discussing it because it has been the bulk of my content this far, and then the other half will be about the need for public health professionals in the agriculture industry or farm related fields. So let's go ahead and get into the current stats of COVID-19 in South Carolina. So as of yesterday, there were 424 new cases, 42 probable cases, 42 confirmed deaths, and 14 probable deaths. And since we've started seeing cases in South Carolina, there have been 113,107 confirmed cases here, 1,491 probable cases, 2,494 confirmed deaths, and 134 probable deaths. As far as testing in the state, there are about 233 permanent testing facilities where folks can have a COVID test administered, and there will be 233 pop-up testing events where it might be there for a day or a few days, and those are going to be scheduled through the middle of October, and I'm sure that they will add to the schedule as some of the testing events come and go. So as far as the country goes, we're at 5.88 million cases and 181,000 deaths, which equals to be about a quarter, give or take, of the worldwide stats, which are at 24.5 million cases and 832,000 deaths. A few weeks ago, there were a lot of trending articles and reports about how family gatherings are like the start of a lot of outbreaks. So I wanted to put that on you all's radar and give you an example that's a little bit closer to home. This happened in Catawba County, Charlotte, North Carolina. There was a family gathering of about 14 folks, and when all was said and done, they had spread the coronavirus to about 40 or more of people. Some of the group were children and most were adults, and the adults that were present, contracted it, and then ended up taking it back to their significant others and other family members that weren't present at the gathering, and then also to coworkers and their families. So it really got out of hand really quickly, and I just want to remind you all that although your state may have certain guidelines in place to make sure that you're acting in your best interest and those around you's best interest. So now let's talk about public health and farming. Personally, I started out as a biology major, and I just decided it wasn't for me and chose public health in a pinch, and had no clue that I would like it as much as I ended up liking it. It was great. It was holistic. I felt that I was learning a bunch of different things, but it also related, and it wasn't just, bacteria and cells. Like it was more real life, like you can see it and like experience it situations, and I really appreciated that, the realism of it. Not to say biology isn't real, please do not think that's what I'm saying, but anyways, I definitely didn't imagine that public health would lead me to be more interested in farming and agriculture work. I truly thought that I was going to maybe do epidemiology, but then I was like, that's a little too much math for me. Then I was thinking about healthcare administration, but just decided that that wasn't a great fit either, and was required to have an internship that happened at Fresh Future Farm, and was also in an environmental studies class, and it kind of just unlocked a whole new world of possibilities within my skill sets. I gained a super interest in the environment and how humans are fueling the degeneration of the earth, to put it plain, and Also was very interested in food systems and how we could rework them to be better for all, including the environment, including animals, including humans. Well, I guess, yeah. So many of us are interested in that necessary change. How do we slow down climate change, put a pause on it? We obviously can't go back and undo it, but how do we preserve what we still do have left so that it is here for future generations? And so with that, I feel like the word sustainability is always thrown around. Like, how can you be more sustainable? How can your business be more sustainable? And like, I guess to me, like, I just want folks to realize that it is more than just a word. But that's a whole other story for a different day. Public health professionals in agriculture are necessary to be that link between the community and what they're facing as a result of mass-produced food, which is preventable diseases such as diabetes, obesity, heart disease, all of it. Everything that that you can contract as a result of your lifestyle or eating habits. And the thing about it is that not only like do we have access to a lot of food, but it's not as nutrient dense as it used to be when folks were growing it at home or growing it down the street. We're eating food that is depleting the soil, therefore not receiving as much nutrients from the soil, and it's just not good. We're eating meat that is fed cash crops that they're not really supposed to consume. That's not really what the animals were made to consume, and therefore we are consuming it if you do eat meat. So there are a lot of layers here, and I feel like the main solution to that is creating more community-based food systems. I feel like that's very popular here in Charleston. We are very, interested in local produced food and restaurants that are farm to table, and that's it's trendy, but how do we make that show up in the greater community? So I see public health professionals, like I said, being that link, and that will result in healthier populations, a healthier environment, and who knows the possibilities that we're able to unlock whenever that is possible. Please leave your thoughts below about how public health professionals could contribute to our food system and, putting a pause on climate change and other risk factors that are associated with the mass production and industrialization of food. But that is all I have for you all today. Hope you all enjoyed the discussion, and I look forward to hearing from you. Please remember that if you are interested in donating, there is a link in our bio, and we will see you all next week on the next Fresh Future Friday. Have a great day.